When I talk about Medicaid planning for long-term care, there's two approaches that we like to talk about. One is advanced planning, and the other is crisis planning. So just keep that in mind. That's an important distinction. They have different objectives, they have different outcomes, and they have different strategies. If I have a client who's 74 years old, whose wife is already in nursing home, went from the hospital, received Medicare coverage for up to 100 days, and then is in need of long-term custodial care that Medicare won't pay for, but they want to see if the state will pay for some of those benefits, that's crisis planning. Mama's already in the long-term care nursing home facility. That's crisis planning. Those strategies are different than someone who says, we're not imminently in need of long-term care, but we know we have assets over here, and we want to protect some of those assets. And we think we can get past 5 years from the plan before we have a need to apply for assistance from the state. Ben mentioned 3 years. 3 years was the look-back period that the state would look at for transfers that had been made for less than fair value. In other words, gifts, for example, to kids. It used to be 3 years. Today it's 5 years. That's what we call the look-back period. 5 years, 60 months. That was changed in 2005. It was extended from 3 to 5. It could be extended yet again, depending on how big a crisis things become. If we have a chance that we think we can get past 5 years, we're in the advanced area. If we have a client or a family where no one is going in right now, that's different planning than crisis. We have solutions for both. You can protect more with advanced planning, but we have solutions for both. I just want you to keep that in mind because that's part of the complication to all of this discussion. And the last thing that's mentioned here is that if you work with a professional, then you can get the guidance that you need. A lot of people try this on their own. People try things on their own and they wind up getting stuck. And if you get stuck, now you have no resource available. You've either given away the assets and you can't get them back, and on top of that, the state's not paying the benefits. Who's going to pay for the long-term care costs? I mean, it's just a disaster waiting to happen. So, really, the question that comes up frequently for us is, who is a good market for us? Who is a good candidate for this type of planning? So take a look at those categories there. Now, if there are folks who are especially affluent, let's just use the wild example of Warren Buffett. Does Warren Buffett need this kind of planning to pay for long-term care for his wife or for himself? Bill Gates? Probably not. The cost for long-term care is not going to make a dent in their wealth or their nest egg that they've worked hard for. It's just not going to make a dent. What about the folks who are extremely poor? The folks who either have lost everything because maybe they had issues or a lack of money management or responsibility, or folks who have been poor their whole lives. Is this kind of planning or is this workshop helpful to them? Well, they're going to get the benefits anyway, right? I mean, this workshop isn't designed to help you fill out the application and just, that's it. We're trying to reach the folks who have worked, who have been told all their lives that they should work and save for their retirement and to pass a little something on to their kids. And now that's at risk. Or maybe it's folks who have inherited a business or a farm or a ranch, especially in South Dakota. These are the folks in the middle that we work with because they have something to lose, and if they lose it, it will be catastrophic, as opposed to the folks who are the especially affluent. Okay. What's that? There's a crystal ball.
That's an estate plan.
That's one of it.
I ask this question all the time with my clients and my prospective clients. Did you bring your crystal ball? And they chuckle and they say no. You know, I have to remind folks that we don't know what's going to happen. I told you that my mother didn't need long-term care. She was in hospice care for 2 weeks. Thank goodness she didn't need long-term care. It would have been quite a lot of work and turmoil to get that. But, you know, maybe you do. Maybe you will. Maybe somebody that you're related to, a spouse or a parent, already needs long-term care. And the fact is, we don't know. And I also don't know as a professional what the laws are going to be in the future. They're always changing. They're frequently changing, and I have to keep up with that and advise my clients. A strategy that's available today may be a different strategy or look differently tomorrow. There's stuff pending in Congress right now where changes are pending. Don't know if they'll be approved, but they're pending. We don't know what's going to happen in the future. You may not need long-term care at all, like my mother. My guess is my father at some point will need it. Physically, he's pretty healthy, but if he does have dementia, and if that continues to be the case, at some point he may need long-term care. We don't know. And so we want to address everything on an individual, client-by-client basis and find out what's available and what can be done to protect and preserve the assets that are important to you according to your why or your objectives. So real quickly, you may know this, some folks don't, but most people do. What is long-term care? It's really when you cannot provide care for yourself independently and when you need assistance with activities of daily living. They're listed up there, some of them. Or you need assistance with instrumental activities of daily living. But long-term care itself is defined by some of those factors. It can be provided either in-home, it can be provided in an assisted living or community center, or that intensive nursing home care. Medicaid itself has a bias that was built in when it was passed as law in 1965. The bias is that they would fund nursing home, and they wouldn't fund anything else. Over the years, that started to change. But by and large, when Medicaid is involved, it is for nursing homes still, even though they talk about having these other waiver-type programs, home and community-based services, they do provide that. Most people are still in nursing home. When we talk about nursing home, we can be talking about someone who goes in and they may not be incompetent, they may be able to be aware of their surroundings, to communicate, things like that. And so the cost for that care is going to be less. But when they progress, their condition progresses, they may be moved into a memory unit, especially with dementia and Alzheimer's. And the level of care is higher, and the expense is higher. And so then the issue is, maybe it's a physical condition, a health issue, it's been a stroke or some other condition, or maybe it's a cognitive issue. I talk about Alzheimer's a lot. Something that's lasted generally 90 days or more that requires assistance with these activities. It can be provided by personal care, coordination, even assistive technologies. That's generally what's defined as long-term care. Let's look at the difference between Medicare and Medicaid. Some people think that Medicare will take care of their long-term care needs. Both of these statutes in Congress were passed in 1965. In my comments earlier, I talked about this really was a culmination of activities and efforts that were going on since the 1930s to try to provide health care as a part of this social fabric, social welfare system. But finally, in 1965, Medicare, which is the health care for senior citizens, and then Medicaid, which was typically viewed as health care for the poor, especially children and mothers, people with disabilities, and the elderly. When it comes to long-term care, that's what's provided. That's the program that provides assistance, financial assistance to individuals and families. It's Medicaid. Medicare will not do that automatically. What they provide, if you are hospitalized as a senior, and you are not able to stay in the hospital because your condition cannot improve with treatment, but you can't go home, then you can receive skilled nursing for up to 100 days, and Medicare will cover some of that. For the first 20 days, Medicare will cover 100%. Some people refer to that as swing bed, between the hospital and home. Medicare will cover 20 days at 100%. What about the other 80 days? You're required to pay a daily copay of $161 under Medicare. And if you multiply that times 80 days, that's going to be $13,000 or $14,000 that you pay out of pocket, and Medicare pays the rest. And then at the end of 100 days, you're pushed out. Medicare won't pay anything else. Long-term custodial care is what's offered and provided by Medicaid, and that's those issues from the previous slide. Not being able to live independently, not being able to handle the activities of daily living. That's long-term custodial care rather than skilled nursing to get you well enough to get home. Medicaid is the program that provides that. It's actually a joint federal and state program. It originated through Congress and through the Medicaid agencies, and it is administered in every single state by a state agency, and each state has a certain amount of discretion to modify some of the rules and regulations on what's allowed and not allowed for eligibility. And so we really have this quilt work, this patchwork of a system that's really 50 different systems in America that deal with the administration of Medicaid at the state level for general health, financing, and also long-term care. So South Dakota is going to have rules that are a little bit different than North Dakota, or Texas, or Colorado, or New York, or California, and some of the rules vary wildly. There's a lot of disparity. I help folks with what we do in South Dakota. There are two ways that there's actually three things that you have to do to qualify for eligibility if you want to seek assistance from the state to cover long-term care expenses. One, you have to be physically or by health qualified because a doctor says you need long-term care. That's your health condition. Second is income. You can only make so much money per month to qualify for eligibility. And the third one is asset eligibility or means testing. How much do you own? How much do you have to not own in order for you to receive the benefits from the state? And that's where we come in to help, is on those financial side, that financial side and those issues to help you understand and to maybe qualify sooner. So who uses long-term care? Let's look at all of these. I'm just going to put them all up at the same time. As of 2014 or so, 12 million Americans needed long-term care or assistance with activities of daily living. 12 million people in America. That's not who's on Medicaid, that's just who needs it. By 2050, those needing long-term care will increase from 12 million to 27 million. I talked about dates. What happened in 2010? The first of the baby boomers started reaching retirement age at 65 in 2010. What happens in 2030? The first of those baby boomers turn 85. What happens in 2050? That's when the last of the baby boomers are going to hit 85. So those born in 1963, 65 or so, that's when you get to 2050. So we're still talking about that big demographic group. And we just see more and more people needing it and the cost increasing enormously. 70% of people age 65 or older will need long-term care in the next 20 years. So just look around. 70% of us will need some form of long-term care. The days when we could live at home with our families, our children, on the farm, all those are over. The days when we would die at a younger age, I mean, that life has been extended, not the quality, but the length. Our kids are moving away. We don't have as much ability to have a home near or in our children's homes. We have to turn to long-term care, and the conditions continue to cause that need as well. All right, so for women need long-term care on average 2.5 years. Men need it 1.5 years. Why is that? Because we die. We die sooner, right?
That's right.
We don't need it as long because we don't live as long. And let's see. Long-term care spending has been growing at an average, and JD, tell me if you know the number that's different than that, but on average 6% per year. That's more than inflation or the growth in gross domestic product.